Dr. Nandakumar എല്ലാവർക്കും അറിയേണ്ടതാണ് കണ്ണൂർ IML. കണ്ണൂർ IML ഏറ്റവും ഇൻട്രൊഡ്യൂസ് ചെയ്യേണ്ട വ്യക്തിത്വമല്ല. ഇതിൽ ആർക്കെങ്കിലും അറിയാത്ത ആൾക്കാരുണ്ടെങ്കിൽ ഇവരുടെ കാര്യങ്ങൾ പറയും. Dr. Nandakumar, Dr. M.K. Nandakumar is an alumni of Calicut Medical College and PhD from MNC Chennai and currently working as senior consultant at HOD Department of Pediatrics, Hospitals, Kannur, and he is the National Executive Board member of Indian Academy of Pediatrics 2021-23. With welcome, Dr. Nandakumar sir.
Respected President, IMA, Kannur, Dr. Suresh, Secretary, Dr. Rajmohan, respected senior members, and my dear friends. First of all, let me thank IMA Kannur for giving us, that is IAP Kannur. I am representing IAP Kannur today to interact with you on a important epidemic in childhood, that is obesity, as a part of our presidential action plan promise. So when we were undergraduate students and PG students, we used to see a lot of cases of malnutrition, undernutrition, like marasmus, kwashiorkor, and that was the main bread and butter of pediatrics at that time. But as the spectrum is slowly changing nowadays, instead of undernutrition, we are getting more cases of overnutrition. That's we can call it as malnutrition. Why it is like that? So just like discussing any other topic, any other conditions, it is mandatory to start with statistics. So according to 2019 data, around 38.2 million children under the age of 5 years are obese. But you can see the prevalence rate of overweight and obesity from 5 to 19 years old risen from 4% in 1976 to 18% in 2016. Definitely, it will be around 20 nowadays, because after this COVID, this pandemic, you can see that the lockdown and this increase, the number of cases increased like anything. Those doctors practicing pediatrics, seeing children, they may be seeing a lot of cases of these overweight children. They won't come for over, as it's said, it's not a complaint. They'll come with some other complaint. And if you take the weight and see, definitely they will be coming in that age group, that is overweight. And coming to India, according to 2020 census, around 14.4 million children are obese. And by 2025, it's expected to touch 17 million children. So that is the gravity of this issue. So why we are discussing this childhood obesity? Because this is one of the most alarming public health issue nowadays in modern world. Childhood obesity tend to track into adult. That's the most important. ഒരു കുട്ടി നമ്മുടെ അടുത്ത് വന്നാൽ ഇത് സാരല്ല ഡോക്ടർ, അത് അവന്റെ വീട്ടിലല്ല, നമ്മൾ ആദ്യം പറഞ്ഞേ കുഴപ്പമില്ല, അത് എല്ലാവരും ഇങ്ങനെയാണ്. But childhood obesity is by pediatrics, there is a separate entity called childhood onset of adult disease, especially metabolic disease. The childhood obesity is one of the most important childhood onset of adult disease. We have to call it as disease. The majority of obesity and comorbidities in adulthood has its origin in childhood. You can see. To take history, those who are the adult physician, you just take history from the childhood onwards. Definitely, നമ്മൾ വിത്ത് പാകൽ എന്ന് പറഞ്ഞില്ലേ, അതുമാതിരി ഈ ഒബീസിറ്റിയുടെ വിത്ത് മിക്കവാറും പീഡിയാട്രിക് ചൈൽഡ്ഹുഡിൽ ആയിരുന്നു. And another important thing is obese children who lost weight and become non-obese in obese adult do not have increased risk of obesity and related morbidity. That is why the importance of treating this condition called obesity. So it can affect almost any organ in our body, starting from cardiovascular, GI, neurological, respiratory, endocrinology, reproductive system, orthopedics, renal, dermatological, any you just name, it will affect all systems, and definitely it has its own psychological impact. So 3 factors affecting overweight: they are genetics, activity pattern, and eating pattern. This is well known to everyone. And children are at increase for obesity if their parents are obese. There is no question. Why? If one parent is obese, 3 to 4 times more chance risk for obesity, and if both parents are obese, 10 to 12 times more risk for obesity. And if a child has obesity less than 1 year, definitely we have to think about endogenous causes, that is genetic and endocrine causes of obesity. Around more than 90% of cause of obesity exogenous, that is due to lack of exercise and decreased physical activity, and only less than 10% due to endogenous cause like genetic and endocrine causes. Here are few genetic causes, like it's very common condition like Down syndrome, Prader-Willi syndrome, Turner, then Carpenter, the Bardet-Biedl syndrome, previously known as Lawrence-Boone-Biedl syndrome. Endocrine causes like Cushing syndrome, growth hormone deficiency, hyperinsulinism, hypothyroidism, and pseudo-hypoparathyroidism. The most vulnerable period in the child, there are 3 most vulnerable period in development of obesity. One is prenatal period. That's more than 90% of fetal fat deposition occurs in the last trimester of pregnancy. So all gynecologists should know it. And infancy, that is 4 to 6 months. There lies the importance of breastfeeding, exclusive breastfeeding. So fat deposition occurs for 50% of total weight gain. Adolescent gross fat, that's another important. That is why we have selected this topic, that is adolescent obesity. Then the lean period in a child's growth is between 4 to 6 years. That is that period only is minimum BMI of this. That this weight gain is minimum during that 4 to 6 years. ഈ സമയത്താണ് കുട്ടികളെ അപ്പം നമ്മളെ പീഡിയാട്രിഷ്യൻസ് ഒക്കെ നമുക്ക് വേറെ ഇൻഫെക്ഷൻ ഡിസീസിൽ നമ്മളെ മെയിൻ നമ്മളെ ബ്രെഡ് ആൻഡ് ബട്ടർ എന്താ ഡോക്ടറെ മെയിലിന്ന് ഭക്ഷണം കഴിക്കുന്നില്ല, ഇവനെ കോലുമാരിട്ടുണ്ട്, എല്ല് കാണുന്നു, നിങ്ങൾ കാണുന്നില്ല ഡോക്ടർ, ഇവന്റെ എക്സ്റേ എടുക്കേണ്ട ആവശ്യമില്ല, എല്ലാം കാണുന്നു. Why? Because that 2 years the weight gain is bare minimum only. That is a growing phase. That is maximum period where this maximum height gain occurs. Then what are the predictive factors in infancy? Birth weight is important. So contrary to popular belief, these children with low birth weight, they are more prone for metabolic disease and later obesity. The premature babies, SGA babies. Why? Because they won't be given exclusive breastfeeding, and they'll be given extra so many other formula milks and this CMILM city like so many these nutrients, so-called nutrients. Then baby born to diabetic mother, then if history of any neonatal complications like CNS asphyxia, CNS other sepsis, any NICU stay, then formula feeding. That's one of the most important curse. So in exclusive breastfed child, the incidence of obesity only 2.8%. It increases to 4.5% in a formula fed baby. So duration of breastfeeding is also important. So nowadays IAP is recommending exclusive breastfeeding for first 6 months. Then we have to continue breastfeeding till 2 years of age. Why? Because it has got its own impact on this reduction of this obesity. The complementary, previously known as weaning, now we used to call it as complementary feeding. Because why? Because we are just complementing breastfeeding. So the food used for this complementary feeding is also very, very important. Then early adiposity rebound. This BMI is already discussed. BMI is least during first 5 to 6 years. And adiposity, this period you can see This is the BMI. You can see the BMI is least during this period, and after that, a spurt occurs. That strongest predictor of adolescent obesity is a rapid weight gain between 2 to 6 years of early adiposity rebound. Then we discuss the parent obesity is one of the most important predisposing factor for this childhood obesity. Why? Because of genetic factors. Definitely genetic factor is there, but we cannot blame everything for that. ഒരു കുട്ടി വന്ന് ആദ്യം പറയാം ഡോക്ടർ ഒന്നുമില്ല നമ്മളെ വീട്ടിൽ എല്ലാവരും തടിച്ചിട്ടാണ്. Why? Maybe genetic will be having some minimal impact, but why? It is because of most often due to eating habits of parents. വീട്ടിലെല്ലാവരും ഒരേ ഭക്ഷണം കഴിക്കുന്നു. But definitely the child will eating what these parents are eating. Then activity person also. നമ്മൾ കുട്ടി വളരുന്ന ഒരു അച്ഛനും അമ്മേനെയും കണ്ടില്ല. If they are sedentary, definitely child is going to be very which is sedentary habits. Then abnormal eating habits resulting obesity. Breakfast. Skipping breakfast is one of the most important risk factors. We'll discuss it later. Then watching this feeding and watching TV. That's the eating and watching feeding. That's another important thing. Then eating in bulks in a very short period. Then drinking sugar sweetened liquids, ice creams, then it's junk foods. Then eating less vegetables and fruits. Then coming to unhealthy eating behaviors, increased intake of fast food which contain only calories and non-nutrients. Having larger amounts in a go, that is big portion size. Then intake of sugar sweetened drinks. Then higher intake of fats, especially saturated fats and trans fat. Lesser consumption of homemade foods, missing breakfast, and lesser consumption of fish, fruits, and vegetables. So it should be bad. There should be a balance between activity and food. Then next thing is the reduced physical activity. Previously, when we were going to school, we were used to walk. Most of us used to walk long time. A generation before us, I think they might not have seen any vehicle or something during that time. So kilometers they used to walk. But nowadays, children barely used to walk. Everything, at least they'll be having their family, each family having 1 or 2 vehicles, either car or auto rickshaw or bike. So this habit is totally disappeared from our society. Next is study. Children, they don't have time for all this exercise and extracurricular because they are embedded with all these studies materials and over expectation of parents, and they don't have time for anything other than study. And these teachers also, they will also, just like parents, they'll be also having this over expectation for they want to increase the standard of their school, they want to show it to other. So definitely the pressure from both parents and teachers. Then TV, excessive screen time. Then you can see these playgrounds are slowly disappearing from our society. They are occupied by this flat and so many malls. These are things what is happening nowadays. Sedentary lifestyle. Then see, even though there is these playgrounds are there, instead of playing, they'll be playing like this. They'll be playing video games. So physical activity, you can see physical activity less than 3 hours per week. That is almost 75% of children. Then screen time, you can see more than 3 hours. This majority are, this is more than 2 hours. And tuition, you can see tuition hours around 7 to 14 hours. You can see that occupies a major portion. So they are very busy with all those things. And naturally, this is going to increase the stress. So especially if child start at 3rd or 8th or 7th standard, nowadays everything starts from 5th or 10th. All teaching, coaching classes, this entrance coaching, MBBS, IIT, all starts from first. Even LKG has started these coaching programs. So this child will be stressed a lot. So there'll be the sleep time. That is another important thing. So in average adolescent, that is 10 to 19 years, have a continuous sleep time minimum 7 hours. So they won't be get it. So in between night they will be definitely they will be definitely under stress. To relieve the stress, they will take some sweets and chocolate. It's one of the most important stress reliever for them. That contains high calorie. Definitely, it is that vicious cycle will go on. Then coming to evaluation. For evaluation, family history is very important because we already discussed the importance of genetic factors. Then family history of obesity, type 2 diabetes, hypertension, lipid level, that is dyslipidemias, then heart disease. Then symptoms, analysis of symptoms, that is comorbidities. We already seen it can affect any organ. So snoring and sleep disturbance due to obstructive sleep apnea, abdominal pain due to GERD, constipation, gallbladder disturbance, disease, menstrual irregularity, PCOD, Prader-Willi syndrome, hip, knee and leg pain due to slip capital femoral epiphysis, food pain due to muscular stress, then polyuria, polydipsia due to type 2 diabetes, anxiety, school aversion, social isolation due to depression, then severe recurrent headaches due to pseudotumor cerebrae, then shortness of breath, asthma. How are you going to diagnose a case of this obesity? In adult, you all know BMI. BMI is a weight in kilogram divided by height in meter square. So BMI is an excellent tool to identify obesity in children. But unlike in adult, only numbers don't convey any meaning. The BMI of a child should plot it in a proper BMI chart. IAP has developed BMI chart. 2015, IAP developed the chart. You can see a 10-year-old child falling, if it is weight, this BMI falls above 23, that is obesity, and 21 means is overweight, and less than that around 16 or 18 means that is adequate weight. If it is coming below that is below 13, that is underweight. That is the importance of BMI chart. Adult we are using the single value, but we are in pediatrics we are using BMI chart. IAP has developed BMI chart. This is two colors, blue for boys and pink for girls. Then coming to metabolic syndrome, one of the most important complications, long-term complication due to obesity. It's a big waist circumference, high fasting blood sugar, high triglyceride, low HDL, and high blood pressure. So metabolic syndrome definition limited to children more than 10 years. For less than 10 years, we won't use the terminology metabolic syndrome. So proportional to abdominal visceral fat deposition. That is the most important thing. Waist circumference is considered as a good predictor of visceral adipose tissue. So Indians are prone to central obesity even with a normal BMI. And we discuss the doctor, that is because of our genetic predisposition. We are like that. Then insulin resistance underlying pathology, and type 2 diabetes mellitus, hypertension, hyperlipidemia, coronary vascular disease, then non-alcoholic fatty liver, polycystic ovarian syndrome. This fatty liver, type 1, type 2 fatty changes, this is very common even in pediatrics nowadays. If you for this abdominal pain, if you send for ultrasound, report used to come as type 1 fatty changes, type 2 fatty changes. Then measurement of waist circumference. Previously, as we discussed during our college days and all, Anganwadi workers' main job is this community, this mid-arm circumference. Now, IAP is suggesting this waist circumference instead of mid-arm circumference. Why? Because this obesity is increasing like anything. So, how we can measure that? This we can use in adults also. We have to use stretch resistant tape applied horizontally just above the upper lateral border of right ileum. Measurement made at the end of normal expiration and recorded nearest 0.1 centimeter. Now, just like BMI chart, we have separate chart for that. Then interpretation: 10-year-old boy waist circumference 10 centimeter. That means 90th centile. If anything more than 90th centile is abnormal. So how I want to clinical, what are the important points we have to remember in clinical examination? BP, as usual, each pediatric clinic, this clinic, we should have BP apparatus and we should record BP. Signs of insulin resistance like acanthosis nigricans, skin tags, triae. Signs of hyperaldosteronism in girls like acne, hirsutism, hair fall, then male pattern of baldness. Then pubertal status, we have to see. Tanner scoring, we have to do. Then hepatomegaly for fatty liver, thyroid enlargement, wheezing, sleep apnea, tonsillar enlargement, and dysmorphic features. Dysmorphic features to rule out endogenous obesity. Then red flag signs of endogenous obesity, that is secondary obesity. What are the red flag signs? Slow linear growth, that is short stature, that is important thing, because retarded growth, that is height. This height is less for that age. Definitely, we have to think about that is short and obese child means it's a chance for this endogenous obesity is more. That is either genetic or endocrine causes. Then cognitive impairment, mental retardation. Usually in other obesity, exogenous obesity, mental retardation won't be there. Then dysmorphic features, abnormal genitals, visual disturbance, then hearing abnormalities. Then how are you going to evaluate a case of obesity? First, the history and physical examination we already discussed. If it is normal, definitely is exogenous obesity. That is, if more than 90% falls in this group category. And if it is abnormal, poor growth velocity, we have to suspect endocrine causes and we have to send patients to endocrinologists. Then hyperphagia, developmental abnormality, and dysmorphic face, hearing and visual abnormality, we have to think about genetic cause and we have to go for genetic evaluation like karyotyping and new generation sequencing. CNS injury, we have to do MRI, and hypothalamic injury can cause obesity. Then early onset, that is infantile onset of obesity, we have to think about genetic cause like leptin and POMC, MC4 are abnormalities. For this, we have to go for new generation sequencing. Then chronic drug intake like antipsychotics, steroids can cause obesity. Then investigations, coming to investigations, fasting blood sugar more than 100, that's a, we have to be careful. Then postprandial blood sugar more than 140, A1C more than 6.5, ALT more than 35, triglyceride under 5 years 75 and more than 9 under 9 years 75, more than 9 years 90, LDL more than 110, total cholesterol more than 170, HDL less than 45, and non-HDL cholesterol more than 145. This is a normal values, this normal range and the pathological level. So if a child coming with fatty type 1 fatty or type changes, we have to do LT, that is SGPT. If it is more than 60, that's the red flags. Then I didn't mention thyroid here because first investigation which we used to order is thyroid, T4 TSH. Any child coming with overweight, parents and doctor, thyroid hormone, thyroid. Why I didn't add thyroid in that? Because it's a short history. This station we'll discuss. 5-year-old male evaluation came for evaluation of obesity, BMI obese range, TSH 9, that is slightly above normal range, and T4 is 9. Then that's it's a normal. Then how are you going to manage? Mild elevation of TSH with the normal T4 is common in obesity. So it is not a, it is conditioned that elevated TSH is a consequence rather than a cause of obesity. So TSH will decrease once BMI comes down. So there is no need for any treatment. If at all you want, you can repeat it later. This is believed to due to leptin mediated increase in production of pro-TSH. It will cause increase in TSH level, marginal increase in TSH level. Then we have to evaluate for comorbidity, that is non-alcoholic fatty liver disease. You have to do ALT and polycystic ovarian syndrome, free total testosterone, free and total testosterone. Then obstructive sleep apnea, polysomnography, Then psychosis, definitely psychology, psychiatric, mental health, we have to refer to help a psychiatrist. Then coming to management part. So exogenous obesity is the commonest one, and among exogenous, two more unhealthy food habits are they reduce physical activity. So first and foremost is we have to discover food. So food is not allowed. That is the most important message you have to give to our patients and society. Family-based interventions are most important, and motivational interviewing is important. Then appropriate. മദറിനോട് ചോദിച്ചാൽ നിങ്ങൾ ഫസ്റ്റ് ഇല്ല ഡോക്ടർ ഒന്നും കഴിക്കില്ല, അത് ഭക്ഷണമൊന്നും കഴിക്കില്ല എന്നാ പറയാം. എത്ര തടിച്ചു വന്നാലും ഇപ്പൊ ഒരു 10 വയസ്സുള്ള കുട്ടി ഒരു 60 കിലോ ആയിട്ട് വന്നാല് ഇല്ല ഡോക്ടർ എന്താ കഴിക്കുന്നു, ഒന്നും ഭക്ഷണം കഴിക്കില്ല, രാവിലെ ബ്രേക്ക്ഫാസ്റ്റ് കഴിക്കലേ ഇല്ല, സ്കൂളിൽ പോയിട്ട് തിരിച്ചു വന്നിട്ട് എന്തെങ്കിലും കഴിച്ചെങ്കിലായി. Then appropriate calorie intake, you have to get the ICMR chart. Then meal selection based on fruits, vegetables, whole grams, lean meat, fish, poultry, less oil and sweetened juices. Eating pattern modification, encourage family meals. Traffic light I will discuss later. Then rainbow colored fruits. This is the traffic light pattern. So green light means it's food containing low calorie, high fiber, low fat and nutrient dense food like fruits, vegetables. Then we can have it unlimited. Next is yellow light food, like nutrient dense but higher in calories and fat. Lean, like lean meat, dietary starches, grains. We have to take it very limited. Then red line, that is important thing. You have to think it's a red, just like red flag. The red like foods like high in calories and sugar and fat. They are known as junk foods. Like fatty meals, sugar sweetened beverages, then fried foods. So we have to take it infrequently and as far as possible try to avoid it. Then importance of breakfast we already discussed. If your child skip breakfast, it causes headaches at school, falling asleep, cannot concentrate, child become irritable, and stomachache will be there, and getting arguments and fight. So diet modification, this is the plate. This plate should be like this, that 50% of plate should occupy vegetables and fruits, and this almost 60% with the grains and 40% with the protein, and also these dairy products. So there are 7 groups of food groups, that is whole grain cereals, fruits and fibers, legumes and nuts, plenty of vegetables, fruits, vitamin A rich fruits and vegetables, low fat milk products, oil low in starch food, fat and without trans fat, eggs, fresh food like meat, fish, poultry. So rainbow fruits, different colors like rainbow. You have to take it. So this prevention of child obesity, let us go 5-2-1-0 rule. What is this 5-2-1-0 rule? 5 servings of vegetables and fruits daily, and reduce screen time by 2 hours, less than 2 hours, and play minimum 1 hour. Then limit this junk 0. So healthy eating behaviors, one is eating together, family, we have to eat together, and children, because most of the time children will be eating in front of TV and they'll be alone, and father and mother will be eating with mobile and all. Then decoratively laid out healthy food and to attract children. Food should never use the bribe, because we should never, because ഭക്ഷണം കഴിച്ചാൽ ചോക്ലേറ്റ് തരാം, അതുമാതിരി ഒരുപാട് റിവാർഡ്, അതായത് മൊബൈൽ കാണിച്ചില്ല, ഇത് മൊബൈലിൽ cartoon matting we should not encourage all those things. Then variety of food items with the different colored fruits and vegetables should be offered. Minimize intake of sensory specific satiety food like containing high salt, sugar and saturated fat, more fruits and vegetables. Then have regular meal and snacks timing. Breakfast should never be missed. Drinking water should be available, and substitute of sugary drinks and juices, the Coca-Cola and Sprite, 7-Ups. Then child, as we already discussed, children used to mimic parents. So healthy food habits should start from parents. Behavioral changes bring low quantity of sugar sweetened beverages, consume higher quantity of dye. We already discussed everything. So average daily requirement of calories, adolescent boy 14 to 18 years requires 2,200 calories per day, and girl that is 1,800 per this adolescent boy of 9 to 13 years 1,800, and if it is moderate activity we can add 200 calories, and it's heavy, it's very active means 400 calories. So carbohydrate 45 to 60% of this should come from carbohydrate, and 20 to 30% from fat, and 15 to 25% from proteins, along with micronutrients and water. So what are these carbohydrate sources? There are cereal, sugar, fruits, starchy vegetables, protein from pulses, milk, egg, fish, meat and nuts and seeds. Then fat sources, visible fat like oil, cheese, butter. Then invisible fat like nuts, seeds, meat, fish. Why should we limit fat? Because fats contain so much trans fat, adiposity, active fat, and this cause atherosclerosis, vascular damage, and cancer. Today morning, there was a discussion between myself and Dr. Sriji about this fat. Sriji asked me why why can't we increase intake of fat instead of carbohydrate? Because most of the time everything there's all blame on used to blame on carbohydrate. Why can't we substitute carbohydrate with fat? Because fat, this calorie content is very high. Carbohydrate, 1 gram carbohydrate content only 4.1 kilocalorie. 1 gram of fat contains 9.4 kilocalories. That's the difference. And most of the fats are unhealthy fats only. They are transferred when this cause atherosclerosis and this vascular damage. Has a direct impact on this vascular system. So we have to limit food with a high glycemic index like glucose, cane sugar, processed carbohydrates, that is without bran, maida, starchy, this maida, all these things you have to limit. And we have to consume this. This is low glycemic index like fruits, vegetables, and whole grains. And low glycemic loaded food we have to consume, that is watermelon, papaya, then pomegranate, guava, vegetables, and other foods you have to consume. Then silent killers are oil, salt, sugar. Then junk food we already discussed. Junk food is ultra processed food, nutritionally inappropriate food, caffeinated, carbonated, and colored beverages, and sugar sweetened beverages. So sugars and sugar sweetened beverages you have to limit. Processed food you have to limit. Visible and invisible fat you have to limit. Junk food we have to limit. Salt and salty food you have to avoid. What to eat? Good carbohydrate, the low glycemic load, fiber rich, whole grain food. Then good protein, that is lean protein. Good fat, that is fish, spinach, kidney, beans, small amounts of nut. Then micronutrients, then water. So remove television from child's bedroom. Don't use food as rewards. Encourage walking. Then we have to ban foods from school canteen. Nowadays, so many schools, as nearby also, we can get all these junk foods, that is burgers, then this shawarma. Then you have to encourage physical activities. Encourage active participation of whole family in physical activities. So these parents should set an example for that. Make school-based physical activity, physical education mandatory. Then intervention must be long-term, sustained, and incorporated to behavioral modification of whole family. Minimum 60 minutes of moderate to vigorous activity per day. Then limit screen time less than 2 hours. This is the types of exercise. Aerobic exercise 60 minutes each day. Then muscle strengthening exercise 3 days per week, and bone strengthening exercise 3 days per week. Then screen time according to American Association of Pediatrics, Academy of Pediatrics recommendation, not more than 2 hours, children less than 2 years, there should not be any screen time. We should not show them all these gadgets. Then more than 2 hours, more than 2 years, 2 hours, maximum 2 hours, non-academic screen time. Then coming to all, after all this, still the BME, everything is uncontrollable. We may have to go for pharmacotherapy. So what are the drugs? So metformin is a very, nowadays it is very, these doctors are very much fond of all this drug, metformin. It is approved in children more than 10 years only. Less than 10 years, we cannot use metformin. Its indications, insulin resistance is a main indication for usage of metformin. If that is impaired glucose tolerance, that is sugar more than 140 milligrams per deciliter, impaired fasting blood sugar, that is more than 100, and elevated HbA1c more than 6.5, that is pre-diabetic stage. The dose is 500 milligram BD, titrate to maximum 2000, that is 2 grams per day. Then one of the serious complications of metformin is lactic acidosis. Dyslipidemia treatment, increased dietary fish. That's the most important thing. That's a that is fish is one of the most important thing for diagnosis, treatment of this dyslipidemia. So it contains a lot of omega-3 fatty acids. So statins also recommended in children more than 10 years only. Indications of statin is if LDL cholesterol more than 190 and LDL cholesterol more than 160 with the comorbidity like obesity, hypertension, smoking, family history of cardiovascular disease. Then dyslipidemia, regular exercise and repeating this fasting lipid profile after 6 months. Again, it is triglyceride less than 120 and LDS below the target, continue exercise and diet. If triglyceride 130 to 200 and increase of, we can increase the fish intake because fish contains a lot of omega-3 fatty acid. And if it is more than 200, we have to go for pharmacotherapy. So prevention already discussed. Birth to 2 years, your exclusive breastfeeding is most till 6 months of age, and from 6 months complementary feeding, we have to continue breastfeeding till 2 years. Then control protein intake, avoid sugar sweetened beverages, promote variety of food, avoid restricted feeding habit, then avoid screen time. We should avoid screen time children less than 2 years. 2 to 12 years, promote education, food knowledge, avoid sugar sweetened beverages. Then 5 meals per day, 6 minutes physical activity, reduce screen time to 2 hours. Fish portion, the 5 portions of fruits and vegetables daily. 13 to 18 hours, allow child to choose snacks, 60 minutes physical activity, and teach how to plan and prepare. An important thing is we teach our children how to cook. So catch them young age. Catching is very easy because obesity diagnosis is very, very simple and very easy, but treatment is Herculean task. It's very difficult because convincing itself is very difficult. There should be a regular obesity screening program starting from Anganwadi and primary school levels. So we should teach our Anganwadi workers, ASHA workers and school teachers how to measure and interpret BMI and weight circumference. That is important. Previously, we were doing undernutrition. We are using this mid-arm circumference, but in obesity, we started using this weight circumference. Thank you.
taking patterns. Can you introduce some classes, some subjects in developments?
So we have to, that's education, we have to incorporate it into our education system itself. And why why we should reduce the screen time? Because they are getting all this information from these social medias only. We can see a lot of advertisements. This advertisement is cola, this sweetened beverages for advertisement, this fancy advertisement of this junk foods like this KFC and so many chickens you can see. Then fried chickens, so many things you can visit McDonald's. So that is why you should limit this screen time, and we should not serve that this near to school. All these shops, they should not allow to sell all these junk foods.
What about taking of other type of healthy junk foods?
There is nothing called healthy junk food. Junk food, all junk foods are unhealthy.
Yeah. Healthy food items should be marketed like this.
For example,
some vegetables like burger, which does not contain heavy fat and other things.
what is junk food? Junk food because
This is advertised properly by Amitabh Bachchan.
for making it a food tasty. The most important ingredients are sugar, oil, fat, and salt. Without these things, you cannot make any food tasty. Food tasty only it should contain all those things. So we cannot make a tasty food without all these what we discussed, these junks. Without sugar, without salt, without fat, we cannot make anything tasty. You ask our ladies.
But the Europeans, they are like less spicy, less salty, and we are like very spicy.
That is our culture. I don't know how to change that, and I'll have to discuss. These issues across the world is issues. This is not an issue of India. These junk food issues there across the world. This is not our issue alone. We are genetically prone for all this cardiovascular and metabolic syndrome. That's all. They are not so prone. We are prone for this. That is why cardiovascular disease, everything is increasing in our society.
Indians food and diabetes, there's a wonderful study called STARS. What it says is that pan-India, all over India, the consumption of carbohydrates is nearly 70%. Whereas in the Europeans, it is less than 40%. That's sensitive. So we are not only known for whatever is the fast food, but we are a high carb. That also matters a lot for and it is true, the purpose study called STAR study. We thought that north will be less, but it's all the same, whether it's east, west, north, south, it's about 70%. STAR study, the Dr. Question. So that may answer your question, right? It's not the spice or it's the what was content of carbohydrate. We think that there is a false notion that we eating or if we have diabetes. So it is not even not, it is even more. It's around 70%.
We have done ECDN training, IAP, that is early childhood development and nutrition. That what we are discussing. So children less than 1 year, their taste buds, this concentration of this taste bud is more. That is 1,100 taste buds per square centimeter, comparing to 17 square taste buds in adult. So that age, if you introduce the salt and the sugar in that time, definitely they are more prone to use all those things in later life. So if you can limit those salt, sugar in that age, definitely the usage of sugar on these things will be less in the later life. That is IAP is recommending you should not use salt, sugar in children less than, added salt and sugar children less than 1 year. That is infancy. You can see the chocolate advertisement nowadays. So funny advertisement of chocolates.
Yeah, when you said about obesity, because what is more worrying is the increasing number of type 2 diabetes in young
Children.
or rather adolescents. So much so, the type 1 and the very says type 1 is around 2.5 per thousand children. Type 2 is more than that. No, that is for children. It's almost around 4%. 4 in not 4%, 4 in 1,000. So this 2.5 in 1,000 is type 1. That means overall type 2 diabetes is more in adolescents than type 1. And that is steadily increasing at the rate of 2.8% every year. No, I'm talking about statistics from Western, American statistics. I don't, that was it's a study there. So that's why I quoted here, the risk of type 2 diabetes is young. And they are carrying this long term. If they have diabetes at the age of 15, and by the time they are 35, they will have everything. Retinopathy, everything is going to come. That is worrying, because if you don't tackle this now, we are going to have 30 plus people with all secondary complications of diabetes. And that's a study, but we just can't plug it out because we are not able to communicate with our people that obesity is not good health. Every mother has a feeling that my child is facing that. My child is leaner. So this is the.
It's very difficult to convince. So, ജങ്ക് എന്നങ്ങനെ എന്റെ മറ്റേ നമ്മൾ ചവറെന്ന് പറയും. ചവറെന്ന് പറഞ്ഞ സാധനം ജങ്ക്. അത് യാതൊരു യൂസ്ഫുല്ല നമ്മൾ കളയുന്ന സാധനങ്ങൾ സാർ. അതാണ് ഈ ചവറാണ്. ജങ്ക് ഇംഗ്ലീഷ് മീനിങ്ങിൽ ഇംഗ്ലീഷിൽ ജങ്ക് പറഞ്ഞാൽ മലയാളത്തിൽ ചവർ എന്ന് പറഞ്ഞ സംഭവം നമ്മൾ വലിച്ചെറിയുന്ന സാധനം. അതായത് it doesn't have any nutrient value. It contains high calorie, high sugar, and with low nutrient value. It does not contain.
That is high in calorie from sugar and or fat and possibly also sodium, but with little dietary fiber, proteins, vitamins, minerals, or other important forms of nutritional value. It's also known as HFSS. HFSS food. The term junk food is pejorative dating back to 1950. And that's why it's right. It's food. That's all. It is unhealthy food. In short, what is it? Is unhealthy. And it's the parents who are responsible, and most of it is the advertising driven.
Regarding
tall, stronger, bigger, all those things, and all the celebrities come in. You have right from Dhoni, everybody running for all those energy drinks. So they're driven by it. You can't help it. When a child comes to your father, I want to drink boost, then you deprive him of that.
Sir.
Because he has seen that somebody is taking it and is going very fast. He's taking that combat, go to all of it. So he's driven by that. So the advertisement driven market. So where there should be a restriction, which is you and
we already started because
there should be factual evidence which is put in the advertisement.
because I already mentioned, because diagnosis of obesity is not a big task, but managing obesity, because convincing parents, that's the most important. Thyroid is not a junk food. This is not a junk food, thyroid. Yeah. Puffs, because puffs contains the maida and oil. Most common complaint why they bring child to pediatrician is micropenis. So frequently used to bring child for this evaluation of micro penis. That's a child be 60 kg, penis will be like this. It's actually, it's not micro penis, it's an embedded penis. Because of fat.
At least we have to respect our own sanity regarding this food plate.
There is heavy pressure on it. The child is seeing in the school, they talk about things today. I had this burger, mega burger, this burger. That the child is driven to know what it is. So that's a heavy compulsion of the
Normal food.
With Zomato, Swiggy, all these people are doing the harm. Within no time it can reach your doorstep. No need of going anywhere. Huh? So many offers.
Taste is important matter. Make is a balance. So we have tried out some ways by which you can make tasty foods. It is able to use of this without sugar and oil. You can't make a tasty.
Once in a while, okay. Sir, Ambalappuzha പാൽ പായസം നമുക്ക് ദിവസം കുടിക്കണം is dangerous. അമ്പലപ്പുഴ പായസം ഒരു 5-6 മാസത്തേക്ക് ഒരിക്കൽ കുടിച്ചോ കുഴപ്പമില്ല. അത് ഡെയിലി കുടിക്കണമെന്ന്. ഇല്ല, നമുക്ക് ഫിഷ് ഉപയോഗിച്ച് എത്ര നല്ല കറികൾ ഉണ്ടാക്കാം. ജങ്ക് ഫുഡ് അല്ലല്ലോ. പാരന്റ്സിനെ വേറെ.
Any doubt from online viewers? Please ask your doubts. We will go to the session. Next is group of friends, very second.
Issue nowadays. Also, I thank Indian Academy of Pediatrics, Kannur branch, for joining us today. Also, thank all members of the Kannur IMA who actively participate in CME. Thank you.